I'm Dr. Craig Escudé, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Welcome to this episode of IDD Health Matters. We're coming to you from the Anchor Conference. It's the American Network of Community Options and Resources. For all of you that are providers out there, it's a great organization to be a part of. Our guest today is Erin Cowart, who is a provider of supports and services for people with intellectual and developmental disabilities. Welcome, Erin.
Thanks for having me, Craig.
So, Erin, tell us a little bit about what you do in this field.
Well, my role specifically, I work for Brandi Community Services, and we're a home and community-based provider for adults with IDD. That's intellectual and developmental disabilities. Of course, I'm sure listeners of this podcast, they understand that.
Not everybody, so it's good to always explain it.
But my position, I'm the vice president. I wear many hats in this field, and in my job at Brandi Soap, but I deal a lot with more of the environmental processes, a lot of the operations side of it, but also I delve deep into person-centered supports on what you would call a certified process coach, or a person-centered coach. We say process coach because we work through processes of implementing person-centered tools and how we support and not just difficult situations that we tend to have with the people that we serve, but how our staff interact with the people we serve and how administrative staff interact with DSPs. You know, we try to really implement person-centered support to the coaching level, to the DSP level, and all the way down to ultimately how we better provide supports for the people that we serve.
Excellent. So, Erin, tell us a little bit about Brandi's Hope. First, start with how did it get its name?
Well, that's a really good question. And I love telling this story. I'll try not to get too long-winded with it, but Brandi's Hope, the namesake is actually from my sister, Brandi Erin Cowart. She was born in 1996. She lived to be 9.5 years old. She was born with Trisomy 18. And one of the things about Brandi, I don't know that our climate was necessarily as person-centered as it is now today.
Sure.
I can see states and with CMS pushing final rule and everything down, we seem to be our thinking seems to be a little more redefined in how we, deliver care to people with disabilities. But I don't remember it really being that way when Brandi was born. We had a lot of, not a great definition of quality of life.
I would second that, and I would say that we still have a ways to go in the positive direction.
Certainly do, but one of the things that we did in our household with Brandi was, we treated her with love, with care, and somebody who was born with a disability that couldn't verbally speak, she certainly could communicate, and we picked up on that communication. We knew certain signs of body language that Brandi did that we knew what she meant by certain things, and, I believe that really enhanced the quality of her life and elongated it. And, it was interesting that somebody who could not talk impacted hundreds and hundreds of people. I've heard several testimonies of people, from people during Brandi's life, even after she passed away, of how she made an impact on people's lives. And my father and our current CEO and president, Danny Cowart, he founded Brandi's Hope in 2010. And what we implemented with, I hate to say the word implemented, but what we did with our sister in our own home, gave her the life that she wanted, or basically gave her a quality life. We wanted to give that to all the people that we could with IDD. So we felt that just because that you have a disability, you may require support to live, but it doesn't and shouldn't enable you from living the life that you want. So that that's the abbreviated version, believe it or not.
I know. And we've known each other for a while, so I know some of the background, but that's a wonderful story, and Brandi's still impacting the lives of people through all of you. And I'm sure impacts the way that you provide supports and services.
100%. If it wasn't for Brandi, we wouldn't be here.
So what are some of the services you provide? I know you have residential services primarily.
Primarily, our largest one is supervised living. We do provide...
And for everybody out there, supervised living means what?
Okay, so we provide, we're HCBS, Home Community-Based Supports. And how do I best describe this?
Basically, you have someone who helps other people live independent lives. Is that a good start? You can elaborate on that?
So one of the things at Brandi's Hope is if you were to, let's say if you wanted to find some of our supervised living services, if you went out into, let's say, our location in Gulfport and you wanted to find a Brandi's Hope
Mississippi,
home,
right?
excuse me, yes, Mississippi. If you wanted to go to one of our locations and find one of our homes, you couldn't, because we purchase just regular homes in regular neighborhoods, because that's what typical adults do.
That's exactly
right. So
right.
the services are, we provide a way for people to be integrated in the community and have a typical life and living just like you and I would. They require a little bit more support, and we have staff that will go to the homes in certain shifts, that will support them during the day or at night. You even have certain people in our supports that may not require as much support. That's supported living. So staffing structure is different for that. But the whole essence around what we do is we integrate people into the community and support them, in whatever
level
they
that
want.
they need.
Exactly.
Yeah.
Right where they're at.
To help them live lives that they want in the same way that all of us want to live the lives to the best of our ability that we want as well too.
That's correct.
Yeah. That's great. So part of the supports and services that you provide, I would think would be supporting people to go to their physicians to get healthcare services or get their healthcare needs met. Are there some challenges that you've seen, maybe in access to certain types of services, and how have you addressed some of those challenges?
Well, it's all about how we're able to engage with our people. And when I say people, not just the people we serve, but our staff. In terms of linking up with, say like a physician appointment. We have on staff, we have what we call healthcare liaisons.
That's the kind of thing tell us more about that.
And they're the ones who are responsible for, I guess you could say, monitoring and scheduling all the physicians' appointments. And they take them to the appointments, and they're the ones that are in there with them, with the clinicians or the physicians or whatever it may be. You may have run into situations to where, you have multiple appointments in one day. That's very rare because, we're pretty good about having their liaison scheduling that out. But if it's more of like routine things, let's say certain shots they need to get are just like a scan of something, we may assign a DSP to take them to there because they're just taking them there. They're doing a shot or whatever it may be. They're not having to produce a narrative or give clinical information to the physician. So our healthcare liaisons, they transport and they talk directly with the clinicians or physicians. We also have, we utilize telemedicine. We have telemedicine equipment on in our locations, our primary day services. We have day programs as it's kind of like a hub where administrative offices are, and in that office, we have telemedicine, and we'll actually, link up and do telemed appointments from there. So we really don't have that many barriers in terms of getting their healthcare needs met.
That's excellent. You have pretty good relationships with clinicians in your area that understand the different ways that maybe a person might communicate their health issues.
Yeah, absolutely. And it's all about how you communicate it too, because often what you find in this field is that a clinician will prescribe medication based off the narrative that you give them. So it's really about not just advocacy, but education and awareness. So I see that there is sort of a gap between what our services provide in this industry and the healthcare world on that other side too, and that we need to better educate on our person-centered support and how we do that model, because some of the times that we find that people who we'll term difficult behaviors, I hate to say that terminology, but I can't find a word for it, but
yeah, challenging behaviors or
yes.
Go ahead, I didn't mean to stop you.
What we term behavior is it's a form of communication.
Right.
And
It's one of my mantras.
Yeah, all behavior is communication.
That's right.
And one of the things is, instead of, most people, and this is not what we try to do, let me just start it from there. What we try to do is we want to know the person that we support on an individual level as in-depth as we can, because whenever, let's say Bob does this, it means this. And we use tools like a communication chart, which is one of the many person-centered tools that we use, which will say, whenever he does this, it means this. When then on the healthcare side, they may say, when he does this, he may need this, meaning a drug. And sometimes whenever you go to those, clinical appointments, the narrative is they're behaving this way, they're doing this, and X go down the list, and then you get a list of medications that they're just going to throw you on immediately.
And I like what you said about the narrative that you provide to the clinicians affects the clinician's understanding or decision-making process. So if you come in and say, well, if you start with this behavior that's difficult, this behavior that's difficult, and that's what they see first, well, the thought is, well, what can I do to stop difficult behaviors? Maybe this medication will help. But if the narrative is, well, we've known John for a long time, and when he has this particular change in his behavior, it many times points to, say, a stomach issue or some other problem. That's a very different narrative, and you're providing that type of information to the clinician, and they may look at it differently and approach it differently, and you may not end up with a medication that the person doesn't necessarily need. So there's kind of a role maybe on both parts. Clinicians, I speak about the need for clinicians to really understand this field a lot better, but what you're talking about too is how providers can help facilitate a better healthcare interaction as well too.
And I'm not discrediting medications, because they're needed sometimes. There's no doubt. What I'm speaking in reference to is that as from a provider, it's imperative that if you're truly going to give person-centered supports, that you have it implemented so down packed to the individual level that whether you know what's important to the person, you know what's important for the person, you're assisting them in their daily living needs, their support instructions. You have a really up-to-date communication chart. That way you've covered all your bases and you know this person. That way you can actually enhance what they need in the healthcare world, because you knocked out all these other variables, and it can maybe help drill it down. So it's imperative that providers, they are the key people to help educate clinicians, physicians, whatever it may be, because, even just outside of what we do for IDD, the IDD population, that's how healthcare should really go in general, broad spectrum, because it's a lot of trial and error. And the more we amplify our person-centered support to the individual level, I think the better we can enhance, what medications are needed, what do they need to get off, because...
Yeah, and just making sure a person gets the treatment, the appropriate treatment, and the best chance at having a positive outcome from whatever the health issue is.
Absolutely.
Yeah. So let's switch gears just a little bit. How about working in this field? I know you see... probably a lot of different things in this field. You work with a lot of different people in this field that have a lot of different roles. What would you say it's like working in this field? Is it challenging? Is it satisfying? Is it both?
It's definitely broad spectrum. It's definitely both, because we don't. We're not a manufacturing company. We don't have an assembly line. We're in the realm of people. Right. And whenever you're dealing with people every day, that can be from staff to primary caregivers, even physicians and clinicians, and even the people that you support.
We've got our issues too.
But there's challenges on both ends. Sure. But I would say that it definitely has the opportunity to be 100% fulfilling, because if you think about it on the level of let's say that you come in as a DSP is probably, I don't want to say maybe they're undervalued. Oh,
I would agree with that.
Because, they're the ones they're the boots on the ground with them. They're the ones they're providing information to their administrative staff. They're the ones who are boots on the ground 24/7. In order to have a successful support plan for the person, I think you have to have, it starts at the DSP level, because they're the ones who, like I said, they're taking them out to, fulfill things that are important to them. They're the ones that are taking them out and learning all this information when, let's say, like if a crisis event happens with them, then they're the first ones on the scene, and then they're calling for, coaches or directors or whatever it may be.
In my experience, they are the people that know the person the best. They recognize the more subtle changes. They're often advocates for the person that they support, and I would say they're definitely undervalued. And and this doesn't sound nice, but I, from a clinical standpoint, we may look at a person who's a direct support professional and say, well, they don't understand the healthcare world, and so I'm not going to really listen to what they say. Mm-hmm. That is the absolute wrong approach to take, because what we need as clinicians is to understand that person, and if the person with the disability can speak for themselves, that's fantastic, and we should always communicate with them first. But many times they rely on someone else to help communicate their needs and what's happening in their lives, and the direct support professional really can do that quite well without understanding all of the medical terminology. Sure. or anything left.
And for that to be impactful, it does start with, let's say, one of our locations that we operate in Mississippi. The head position, we'll call it a site director. It starts right there, because their leadership is going to trickle down to the supervisory level, down to the DSP level. If you don't have staff that are bought in to person-centered support, then that's going to that unbelief is going to trickle all the way down, and then you start to see a revolving door of DSPs, and turnover just skyrockets.
So we know that there's a lot of turnover in the field, and it sounds like there's a lot of training that needs to happen for people to become good supporters of people with intellectual and developmental disabilities. Do you find that the better trained people are, the more likely they are to be successful at their job and also to want to stay in it? Does good training help turnover as well?
100%. Good training, but in terms of that training, we have to explain the why. If they don't understand the why, then they will not become bought in, because you have good staff and you have bad staff. That's every business. Sure. And I think those people who are just looking for a job to clock in and clock out, they're the ones that we're experiencing turnover with. And I think that I can speak for any provider. Whenever they come in and they understand the why and they're bought in, and they're well trained, that's one of the things that we do as a provider. Is our training is, we emphasize training very, very, very hard, and we're very excellent in our training. And we have noticed that staff that are trained but also bought in, they're the ones that we retain the most, and those are the ones that you want to be with your people, because then they're actually going to implement what you believe. They're going to implement. It's the difference between what we say and what we do. They're the ones who actually do person-centered. That's lack of a better term.
Well, it's clear to me just from our talk, but knowing you personally as well, you do what you do. You don't just say things and expect everybody else to do it.
You got to walk it, can't talk it.
And you've always done a great job of providing supports and services for people with intellectual and developmental disabilities. And it certainly comes from the heart and your own personal experiences. So one of the things I like to do at the end of each podcast session is talk about 3 things in 3 minutes. So I'm going to ask you to give us 3 things in 3 minutes that the listeners that you think the listeners might benefit from, that you think could help just really open up the world of supports and services for people with intellectual and developmental disabilities, and just improve things in general.
Seems like a tall order in 3 minutes.
Yep, but I think you're up to the challenge.
So 3 things.
And I won't hold you to it.
To me, the first thing is going to be leadership. It's like I said, if people... How do I best say this? 3 minutes is tough. Put me on the spot there.
Forget
Craig.
about the 3 minutes and give us the 3 things. That's much more important.
Leadership is most important. And, people want to take ownership in their jobs. And they're never going to achieve ownership until they understand the why, like I said, and they're bought in. And what they need to be bought into is the person-centered way, not the caregiver way. And what I mean by that, when we say person-centered all the time, you view it in the lens and the scope of one person at the time. And you look at their profile. We need to know what's important to them. We understand what's important for them, their healthcare needs, their daily living needs, whatever it may be. But that has got to get implemented from your top leadership on down to your supervisors and down to your DSPs.
And finding the balance between the important to and the important for part. And
exactly.
That lies in a different place for each person that you support.
That's correct. Yeah. Another one of the things we talk about in terms of DSPs, whenever you have effective leadership, they're bought in, you eliminate you're going to find in your field that you eliminate the need for convenience, because then you'll start to find fulfillment. And what I mean by that, they'll start to realize, hey, I am an integral, if not the key part in getting this person to maintain and achieve a quality of life. While they're supporting them out in the community, they're engaging in them in their relationships. They may create a relationship with them. They get to see things that we don't typically get to see, as administrators all the time. They get to see joy and happiness in their face. And one of the things that I found is that a lot of the people that come to our services, they're not used to that type of care and support. I think you have a lot of people coming from more congregate type, settings and things like that. Like I said, there's a lot of work that needs to be done nationally toward person-centeredness. But when they come, and I'm not just trying to do a sales pitch for Brandy's Hope. I'm just saying this is how things ought to be. And this is what we've tried to do since conception. And there's always a learning curve, and we're constantly innovating and growing in this industry. But that's just the thing. There's fulfillment in your job, and there's fulfillment as a DSP. It should be a coveted position, because you're there and you're the key factor. And you can be a leader. That's right.
Certainly, you can have a profound impact on people's lives. Ultimately, those things will probably have a profound impact on your own life. I would think as well too.
100%.
So it sounds like you would say that being a direct support professional, or really working in this field in general, can be very rewarding for people.
Absolutely. And when I was talking about it starts with your leadership, there's a principle of decentralized command where that leader can't be all things to all people and everywhere all at once. They have to lead in their respective role and lead their team under them, and that team will lead directly under them. That'd be the DSPs. Mm-hmm. The DSPs, then, as you said, they are leaders. They're the ones who are with the people 24/7. They should own that. They have ownership in what they do. If they find something that's important to the person, or if they find something that wasn't listed on their support plan, or where ISP or ASP or whatever it may be, they get to go to their administrative staff and say, hey, we discovered something new about X, Y, and Z, and may be integral to how they're supported every day. It may be something that's important to them. You don't know.
Sure. So Ian, I love the mindset, the background, the story, the work that you do. It sounds phenomenal. I know it is personally, because I've seen it in action. I really want to thank you for sharing all of this with everybody, for being here today and taking time out of the conference to talk with us today. And love to catch up again sometime and see what's happening in the world that you're working in, and see what new things are going on.
Absolutely. That sounds great.
Great. Thank you so much for being here today.
Thank you.